This is Jennifer Shepard, specializing in integrative manual physical therapy, combining it with functional medicine. And I would like to share with you what this work looks like in the clinic. I am a manual therapist. I work with my hands. And the trained hand has the ability to feel within your body. The trained hand can feel when there's abnormal tension in tissues or your fascia or your joint. The trained hand can feel when an organ is struggling, if there's a little too much heat coming out of it, or the organ doesn't have good mobility to do its job well, or if the organ doesn't have adequate vascularity to it, it will struggle. So my trained hand, as you come into the clinic, actually, let me preface, I'm always looking at how you stand. I'm looking at how your posture lines up, and it's not about good or bad posture, but it's how has your body figured out how to stack itself against gravity and right your eyes to the horizon, despite everything you've endured over time. I watch everybody walk. That tells me so much about, again, what injuries, what illnesses, any inflammatory processes that have happened within your body that have resulted in the need for your body to adapt as you walk. And very often when I see neck pain, back pain, hip pain, you name it, a lot of orthopedic issues are driven by the way you walk and because your body has to compensate. So therefore areas don't move well, your body finds another way to move. It's brilliant at accommodating until it gets to the point where it can no longer. So these accommodations result in increased wear and tear at the lumbar spine, the neck, other areas. So that's a place where I identify what are the primary areas where we need to go. As you come onto the table, I'm looking at how well your nervous system, the dura is the covering of the brain and spinal cord, blending all the way into your nerve roots. So I'm looking to see how healthy, how's the excursion of those tissues. How is there any tug of war on the brain and spinal cord? Again, the trained hand can feel down to these very precise depths. And again, these are things we can feel that do not show up on a lot of scans unless we're really, really looking for these little, very subtle changes that may or may not show up. Sometimes they show up, but very often they don't show up in MRI. But our hands can feel when there's an adhesion or a restriction somewhere in the tissue. So as we get onto the table, the trained hand is able to identify, hey, there's tension in the dural system, or the liver, the liver is not having adequate mobility, or the blood supply to that organ is impaired. So I go through your entire body. We're going to look at the brain. We're going to look at the chest. We're going to look at the pelvis. I look at your whole body from head to toe. I feel your whole body from head to toe. And your body is brilliant. It is super wise. And it also helps guide me along the way. But I'm looking to see what's the area of most tension, stress, strain, trouble. And very often, sometimes those areas correlate with, yep, that's where it hurts. But more often than not, we are uncovering areas that are deeper, older, that are layered upon layered, resulting in symptoms somewhere else. And that's why symptom-based approach really does not help many people at all, because there's many, many whys, many layers of accumulation, and then the body gets to the point it can no longer compensate. And then we get into trouble. So it's my job to help unpack, unburden your body so that your body can do its job with greater ease and be less strained. So as someone comes on the table, I'm able to identify the priority list of what systems, is it a detoxification system? Is it the GI? Is it vascularity? Is it pressure? Is there an abnormal pressure system in the brain? Is there a tug of war somewhere through the nerves or the tissues? Because the body doesn't like tug of war. The body doesn't like too much compression. The body needs space. The body needs ease. The body needs to be able to let all the fluids flow, whether it's your lymph, your interstitial fluid, your arterial blood, or your venous blood. All of those processes need to be efficient to keep you healthy. So on the table, I help you identify those pieces. I identify the priority list of your body. And that also coincides with the work that you are doing with the Foundations for Functional Health program, which supports all the work I do in the clinic. And it helps carry over these pathways that we're working on in the clinic. It helps carry over the strength, stability, the awareness, the connection with the body to help your body work optimally as a whole. After that first session, as we've made our priority list, often people, what do I expect to feel? Sometimes maybe you'll sleep better. So I'll let you know, here's what I noticed, here's what I worked on, here's how it relates to your symptoms. I come up with a couple different hypotheses. Sometimes we don't exactly know exactly what's happening or what happened, but here's what we found. Does this make sense with what you're dealing with? And very often it does. So I'm always looking to send you out with better mobility, better rhythm, greater ease in your body each time. And I have my own set of pre-test and post-test. So I know here's the changes that I made in your body. What are you going to pay attention to see what changes you make? And again, for a lot of these people, a lot of you, it's been probably maybe even 30, 40, 50 years of accumulation. So it's not, we fixed everything at one time. The body is wise and it says, hey, here's how much I can handle at one time. Again, I get my best results when people are working on their inflammation, detoxification, their structural support, and their nervous system. So that helps my work so much more. So as people come back in, I like to see people closely the first few sessions because I want to know how their body do with treatment, how did their body respond, what changes did their body make, and where do I need to go next. So each time I never quite know where we're going to go. It really is body driven because your body is brilliant. It's so brilliant and it's always finding ways to adapt. So you come back in and I check in to see, okay, this is better from last time, or I lost some pieces here. Where's the next place I need to go? What are my goals for your tissues and organs? What am I hoping for your organs and tissues? And then how does that correlate with how you want to feel for your health, for your life? So that is the work. Initially, it's labor intensive on my side. You're working on your foundations work, which complements my work so much, but it really is problem solving, identifying, restoring. What do I need to unburden for you? How do I help your body come to a better state of balance and ease? And then as it's like peeling the layers of an onion. So as your body is less burdened, as your structures have greater ease, as the systems are able to work together, communicate together, like as we get into the hormonal systems, how well are these organs able to communicate to each other? How well is the nervous system able to support all of the systems in the body? And everything is interconnected. There's never one thing. There's not one system because one system affects 20 other systems. So it really is a dance of how do we support your body. But as your body starts to work better, you're starting to feel better, which is super exciting. So then we back off on there's less work for me to do. So I don't want to see people once a week forever and ever and ever. Sometimes people need a lot more work. So it takes a lot more work. Some people, they clean up quicker. It all depends on underlying genetics and how much injury, trauma, inflammation you've had in your body, trauma throughout a lifetime. So it's different for everybody as far as like how long is it going to take to get you where you need to be. But then down the road, I see people once a month. I see them a couple times a year. And the exciting thing is once your body is in a better state of health, it should stay in a pretty good state of health unless you fall down the stairs or you get in a car accident. And or if you're not doing the work you need to do to keep your body structurally healthy, keep your inflammation low, support your nervous system. So this work is very exciting. Our work is known for finding the needles in the haystack. And my favorite, I mean, every patient is my favorite, but when we're able to identify missing pieces, and really the structural work is the missing piece of medicine. It's the missing piece of functional medicine, is this aspect of structural health on a deeper cellular tissue level that the trained hand can identify and restore the healthy, efficient mechanics of inside the body affecting the whole.